Well, respiratory illness season has arrived, and starting today, both flu and COVID-19 shots are available to the general population.
So for more on this year's vaccination rollout, we're joined live this morning by Dr. Danielle Manis, Chief of Family at North York General Hospital. Dr. Manis, good to talk to you this morning. It's that time of year when people start thinking about rolling up their sleeves. I realize to the higher risk groups, it's already out. Do we know, though, before we get into the sort of general population, how much uptake we saw from those higher risk, more higher recommended groups?
So thanks for asking, Nick. Anecdotally, I would say there's been excellent uptake. A lot of those people really understand the risks of catching some of these viruses and will go out of their way to get vaccinated. And because vaccines like COVID vaccine and flu vaccine have been so readily available in pharmacies with extended hours, we're seeing a lot of, especially our older folks, taking advantage of those.
Okay, so the rollout is today in terms of the general population. Remind me the ages again. It's been a while since my kids were 6 months old. I think that's how old your youngest has to be before they get a shot. And are these shots available at pharmacies as well as doctors' clinics?
Yes. So there's basically sort of three main respiratory viruses that we can vaccinate for. So there's flu, of course, there's the COVID-19 vaccine, and then there's the RSV vaccine. So for influenza vaccine, you're correct. 6 months is the minimum age for vaccination. But I always want to remind people that infants are very high risk in terms of getting seriously ill with flu. So if you have an infant who's younger than 6 months and can't be vaccinated, we really encourage everybody who's in the household and who has contact with that young infant to get the flu vaccine. And same with COVID. 6 months, again, is the youngest age to get the COVID vaccine.
Doctor, the one thing we know about flu season here is that it kind of follows flu season in, the southern hemisphere. What have we learned from that sort of may help our campaign, at this point?
Excellent question. And we are lucky in that sense that the southern hemisphere gets influenza outbreaks before we do, so we could use that information to guide our vaccine development. So what we've learned this year is that from the Australian strains that are essentially what we have been put in this year's flu vaccine, there seems to be at this early stage a fairly good match, meaning you can expect reasonable risk reduction or a reduced chance of catching flu if you do get vaccinated this year.
Okay, lastly, we want to touch on RSV vaccinations. Can you remind us who's eligible and who can get it at this point?
Absolutely. RSV is a really important virus that's been around forever. And there's two main age groups that are most at risk, and that is infants who are 8 months of age or less, essentially who are born from April 1st of 2025 onward. Those babies are eligible for RSV vaccination because they are quite at risk. And if you are expecting a baby anytime from now until the end of RSV season, your baby will be offered vaccination in hospital before discharge. But if you've missed that window and your baby was born a little bit earlier, you can access that vaccine through your family doctor, pediatrician, or a nurse practitioner's clinic. And then the other big age group are older adults. And new this year for adults 75 and older, the RSV vaccine is free, which can, again, get received at a pharmacy or physician's office. What's different about that vaccine is it only has to be given once. So it's not like the flu vaccine that you need to get after a year.
That's interesting. And doctor, can you quickly remind us, is there any sort of need to stagger all of these various vaccinations here? Certainly for kids, it can be a challenge if you say, hey, come on in, you're going to get 3 needles. But I mean, just in general, do you need to think about, a week or two in between?
You actually don't. It's not fun to get 3 needles all at once. We all know that, but you do not need to stagger them. And the reality is that it's much better for uptake and convenient if you get multiple vaccines at once. So you can go into the pharmacy, get your flu and COVID together, RSV if you're eligible. You may experience a little bit more of those minor side effects like a sore arm or some aches and pains or even a mild fever. Sometimes it's better to just get it all done and then you're protected.
Okay, very good information, Dr. Danielle Manis, Chief of Family Medicine at North York General Hospital. Appreciate your time this morning. Thank you.